This was yesterday, Vienna's famous Christmas market rammed with people cramming in some last-minute festive shopping before the country was once again plunged into lockdown. And indeed, this was the same market today. Austria is facing soaring COVID cases, increasing deaths and some intensive care units reaching capacity. But it has sparked outrage. On Saturday, protesters making their feelings known, not just about lockdown, but about the mandatory vaccinations plan for February. Organised by the far-right Freedom Party, the placards read, "Coronavirus dictatorship, unvaccinated equals 100% safe." Austria has one of the lowest vaccination rates in Europe. Just 66% have had both jabs. Across Europe, the Delta variant is spreading fast, and so too are the protests. In Brussels last night, police used water cannon against some protesters. They in turn reportedly used smoke bombs and fireworks. The Belgian government has introduced mandatory mask wearing and working from home. In the Netherlands, a 3-week partial lockdown led to 3 days of protests. 5 police officers were injured in Rotterdam on Saturday. This morning, the Dutch Prime Minister Mark Rutte described it as pure violence by idiots. While the German health minister said this.
Wahrscheinlich wird am Ende dieses Winters so ziemlich jeder in Deutschland, das wurde ja manchmal schon etwas zynisch genannt, geimpft, genesen oder gestorben sein. Aber es ist tatsächlich ja so. Mit der sehr ansteckenden Delta-Variante ist das sehr, sehr wahrscheinlich.
The UK's infection rates are significantly below Austria's, 1,092 per 100,000 over the last 7 days, compared with 425 for every 100,000. But they are 4 times higher than Italy.
Something very strange would have to happen for our trajectory to dramatically change in the way it has, for example, in Austria over the next few weeks. And my personal hope is we've got a quarter of people over the age of 12 who've already had a booster. If we can really continue to deliver those booster vaccines and also encourage people to engage with those protective behaviours, even if they're not required, face coverings being the classic example, then we can avoid some of this. It doesn't mean things are not going to get worse. It just means it may not be a disaster.
However, tomorrow the Scottish Government could announce stricter controls as case numbers rise, possibly an extension to the vaccine certification scheme. In England, the government is relying on the booster rollout, today seeing it extended to those 40 years and over, and still no suggestion of Plan B, mask wearing and working from home.
Well, joining me now from Hamburg in Germany is Dr. Ralf Reinches, Professor of Epidemiology at Hamburg University of Applied Sciences. Thank you for joining us. If you look at the graphs in many European countries now, it's suddenly going up for cases. Why is that happening?
Good evening, first of all. Yeah, the situation is increasing dramatically because of the autumn period, which is perfect for the virus to spread. And we were, in many countries in Europe, not well enough prepared. And there's a big problem. The biggest problem is probably the pandemic fatigue in many nations.
And for the vaccination rates, which are lower than many countries, lower than Britain at the moment, lower than many Asian countries as well, why is that? Is it because of vaccine skepticism, or again, is it just sort of fatigue? People can't be bothered to get around to it.
It's probably a combination of all those factors and maybe a few other factors. Traditionally, reluctance to get vaccinated in some parts of different countries, like for example in Germany. So it's a difficult question to answer in detail.
The policy response, at least in Austria, is to make it compulsory. If you have a skeptical population and then you make vaccination compulsory, that is, as we've seen this weekend, an incendiary combination.
Yes, this is a psychological problem, maybe a bit difficult for an epidemiologist to answer, but I think this is one of the factors which needs to be taken into account while making further decisions also in other countries.
Is the German health minister right to say that by the end of the winter, everybody will either be vaccinated, recovered, or dead?
It looks very much like that, with the possibility of the virus spreading so effectively at the moment, that almost everybody who's not vaccinated will have a big chance of being infected. And as we see, hospitals are running full in different parts of Germany at the moment. And therefore, it looks like large parts of the unvaccinated will be certainly experiencing an infection.
For the last year and a half, we've constantly talked about mutations and the risk of something worse than Delta. What's your feeling about that right now?
Yeah, we cannot be sure when and or if further mutations will take place. Obviously, the Delta variant is relatively stable and is very effective in spreading. So it's causing us enough of a problem. Hopefully, further mutations will take a while.
And what about the approach towards vaccinating children, which again is patchy across Europe? I mean, does Europe need to have a more coordinated approach to this, you think, in order to get on top of it?
I certainly agree on this. I think we all should work much closer together because the virus doesn't respect borders, and you can see waves going from one country to the other, affecting all of us. So a common policy, a European policy at least, would be very important, especially as Europe at the moment seems to be the epicenter globally. So we should work together much more closely. So
sitting where you are, when you look at Britain, with vaccination rates around 80%, the booster program going quite well, vaccinating children, and no lockdown, and basically a pledge from the government not to lock down, is Britain looking like it's got it right?
It's very difficult to say, really. I mean, everybody was really wondering about the decision in the summer, which sounded really odd to many others. But it was a period when the epidemic wasn't that high. The wave wasn't, the risk was lower than now in the autumn. It remains to be seen, but to reduce restrictions, the summer is certainly better than the autumn or winter.
Dr. Reinches, thank you very much indeed.